Now I will explain how you can easily remember the causes or differential diagnosis for splenomegaly so easily. Just remember the three primary causes with C.I. and P: congestive, infiltrative, and proliferative. The spleen is located on the upper left side of the abdomen, under the ribs and above the stomach. The spleen is a lymphoid organ. As you know, a lymphoid organ is a well-organized and encapsulated lymphoid tissue that produces lymphocytes and plays a role in the body's immune system. So the spleen filters blood, stores it, and produces white blood cells to help protect the body from infection. The lymphatic system is classified into two: primary and secondary. Primary lymphoid organs are those organs, such as bone marrow and the thymus. They make special immune system cells called lymphocytes. Whereas the secondary lymphoid organs are lymph nodes and the spleen. The secondary lymphoid organs are organs where the cells of the immune system do their actual job of fighting of germs and the foreign bodies. So primary lymphoid organs produces immune system cells called lymphocytes, whereas those immune cells do their job at the secondary lymphoid organs. Primary lymphoid organs are bone marrow and the thymus, whereas secondary lymphoid organs are lymph nodes, spleens, and the other cells that is found in large bowel. Splenomegaly is an enlargement of the spleen. A normal healthy spleen is about the size of that person's fist. But several medical conditions can cause it to swell up to 40% larger. Splenomegaly is not a disease by itself, it's just a symptom of underlying disease. There are a difference between splenomegaly and hypersplenism. Hypersplenism is defined as splenomegaly plus one or more blood cytopenias. When this splenomegaly causes destruction to the white blood cell, red blood cell, or platelet, it is called hypersplenism, whereas splenomegaly is just enlargement of the spleen. The spleen is a lymphoid organ that filters blood instead of lymph. So even though a spleen is a lymphoid organ, it doesn't filter the lymph. It filters the blood. Because unlike lymph nodes, the spleen lacks afferent lymphatic vessels, and therefore all cells and antigen enter the spleen via blood. That is why it filters the blood instead of lymph, being a lymphoid organ. It lacks afferent lymphatic vessel. An enlarged spleen is a physical exam finding that has a broad differential. We say splenomegaly based on the size of spleen for age, as you see on this table. The cause of splenic enlargements are numerous, but to make it easy, we classify them into three distinct categories: congestive, infiltrative, and proliferative, C.I.P. We classify splenomegaly based on Hackett's grading system for palpable spleen. Grade 1 is spleen palpable only on deep inspiration, whereas grade 2 is spleen palpable on mid-clavicular line, halfway between umbilicus and the costal margin. Grade 3 is when the spleen expands towards the umbilicus, or when it reaches the umbilicus. When it passes the umbilicus, it is grade 4, and when it reaches towards the symphysis pubis, it is grade 5. As we have said, we classify the causes or differential diagnosis of splenomegaly into three. From this, the first is congestion. Increased blood pressure in the splenic vein can cause a cascade of congestion, hyperplasia, and fibrosis in the spleen. This can be due to direct occlusion of the splenic vein, such as in a splenic vein thrombosis, or any pathology that causes portal hypertension, such as cirrhosis or right heart failure. Remember to look for signs and the symptoms of this disease. In cirrhosis, always we should have to check for jaundice, varices, spider angiomas, and the secondary signs of cirrhosis, ascites. Pancreatitis can present with severe epigastric pain radiating to the back, because splenic vein thrombosis is most of the time a complication of pancreatitis. The second is infiltration. The spleen is highly vascularized organ. It plays a central role as a peripheral lymphatic organ. As such, it is prone to invasion by malignant and non-malignant causes. Malignancy including lymphomas and leukemias, as well as other metastatic solid tumors, can cause splenomegaly. Depository diseases such as amyloidosis, sarcoidosis will likely manifest in other organs in addition to causing splenomegaly. Also, the spleen is often one of the primary sites of extramedullary hematopoiesis in the case of myeloproliferative disorders. The third one is proliferation. The spleen filters blood, and when doing so, it is a major source of protection against blood-borne pathogens as well as other blood abnormalities. So this causes the spleen to become hyperfunctioning. Hyperfunctioning of the spleen causes enlargement. This can be the result of acute infection such as CMV, Epstein-Barr virus, or bacterial causes such as disseminated tuberculosis, fungal causes, and parasitic causes such as visceral leishmaniasis and malaria. In the case of malaria, it is called tropical splenomegaly syndrome, or enlargement of the spleen due to chronic malaria infection. Filtering the blood of abnormal cells or structures can also cause hyperplasia of the spleen. This includes spherocytosis, hemoglobinopathies, and the sickle cell disease. So, up to 60% of palpable spleens on physical examination are found to be normal sized on imaging. So always, when we palpate spleen, we should have to confirm it by doing ultrasound. Ultrasonography tells us the size of the spleen. In addition, the vasculature, and it may even tell us the underlying causes. So when we find a baby or a person with splenomegaly, focused history is important. History focused to the underlying cause and also complications. And imaging should be done. Abdominal ultrasound is very important. It tells us the enlargement of the spleen to be splenomegaly or normal size for age. And investigation should be based on possible underlying causes and the complications that we identify on history and the physical examination. So we can do CBC, peripheral blood smear, and liver function test, enzymes, and coagulation profiles such as INR, PT, and PTT, and also synthetic activity such as albumin. And we should have to manage based on the underlying cause. Counsel to avoid abdominal trauma to prevent splenic rupture. A patient who is having huge splenomegaly should have to avoid abdominal trauma such as contact sport to prevent splenic rupture, which is a deadly condition if it happens, and treat the underlying cause. Thank you.